This podcast is intended to provide information for educational purposes only and to serve as a starting point for you to have a conversation with your personal physician. Nothing stated on this podcast should be considered medical advice. Consult with your physician before undertaking or changing any treatment plan.
A lot of people look at diabetes and say, well, it's from too much carbs because the diet is like less carbs. We're measuring your glucose level. So people look at this and think it's carbohydrate consumption, overconsumption of carbohydrates that's causing diabetes. That's not what it is.
Here we are at episode 40 of the Pound of Cure Weight Loss podcast. This is going to be our Q&A segment. So GLP-1's or bust?
Yeah, well, all VSG patients need GLP-1 meds. That's the title. I think that's a big question on everybody's mind. I certainly have been pretty vocal about talking about how important it is to combine the sleeve and GLP-1 meds together. All right, well, let's move into our first question.
Yeah, first question.
First question comes from YouTube, from Ben. How does a diet high in animal protein lead to diabetes? Isolated from consumption of bread, for example. To me, that claim makes no sense. Please explain.
So Zoe, what's your take on this question?
Well, I think we want to think about the nutrient density of produce, right? Our vegetables and our fruit are dense in not only other nutrients, but specifically phytonutrients,
Right.
which are nutrients that can only be found in plants, right? And that is really not only has a ton of benefits, but if we're thinking about specifically as it relates to diabetes, that actually promotes insulin sensitivity.
Right. Absolutely.
And your response to that insulin and to better metabolize it.
Yeah. And I think that really is the underlying answer to this question, which is a lot of people look at diabetes and say, well, it's from too much carbs because the diet is like less carbs. We're measuring your glucose level. So people look at this and think it's carbohydrate consumption, overconsumption of carbohydrates that's causing diabetes. That's not what it is. It is a breakdown in the way your body manages carbohydrates. And so as a result, eating too many carbs causes your blood sugar to stay artificially high. That shouldn't happen. In a healthy metabolism, you should be able to pig out on bread and chips and all kinds of stuff, and you'll get a little spike, and then it'll come down and stabilize, and your body will manage that glucose without keeping this artificially high blood glucose level. And so the question is, why does this break down? And when we start to look at it, study after study has shown that consumption of animal fat is directly linked to the development of type 2 diabetes. So even though animal fat doesn't raise your blood sugar, it causes your insulin receptors to become less sensitive. You develop insulin resistance as a result of eating too much animal protein.
And then that insulin can't bring that glucose into the cell, which creates that artificially high blood glucose level.
Exactly. And I think that's the missing piece that a lot of people don't understand about diabetes is they look at it as like, I just have to bring down my sugar. And if I bring down my sugar, I'm treating the disease. But we have to go a step deeper. That's what GLP-1s are about. GLP-1s work partly by making your body much more sensitive to insulin so that we can lower that insulin levels. If there's one thing that makes it hard to lose weight, it's high insulin levels. That's why we see less weight loss without question for all means, from nutritional change, from exercise, from GLP-1s, from bariatric surgery. In all of those cases, all of those treatments for obesity, patients with diabetes lose less weight than non-diabetic patients. And it's because they have this high circulating insulin level, and insulin is a fat storage hormone. So it's almost like your body is making a medication that causes weight gain, causes your set point to go up.
Very interesting. I mean, it reminds me of our conversation with Dave a couple episodes ago, and his doctor told him to go on keto, and he said he white-knuckled keto, and like his diet, the weight loss wasn't that significant, and the diabetes didn't really get all that much better. I think that really spearheaded the whole this conversation.
Absolutely. All right, well, let's move on to our next question.
Okay.
Next question comes from Missy on Instagram. How long should you be on the Metabolic Reset Diet?
So the Metabolic Reset Diet, as you wrote it in your book, is kind of that first stop to not only reset the metabolism like the name says, but also detox from the processed foods, reset your taste buds so that you don't crave those foods so much anymore, along with the weight loss and all those really great benefits. But ultimately, doing the Metabolic Reset Diet for at least 2 weeks, if you can do it for longer, great. And then what I like to work with patients on specifically with the Metabolic Reset Diet, maybe they do it for 2 weeks or a month, something along those lines. Then we want to decide together what those adjustments need to be in order for the Metabolic Reset Diet to be your diet, right? It's not just a diet that you do for 2 weeks. We're shifting our overall diet to mirror the Metabolic Reset Diet with those small adjustments. Maybe it's including a serving of whole grains every now and then. Maybe it's, all these different components, the stations that you go through in your book, but specifically individual to each person, because what one person might be desiring an adjustment towards to make them be able to follow that long term is going to be different than somebody else, right? And it's all about what can we do for this to be your baseline with some tweaks long term.
Yeah. I mean, first of all, we get asked this question all the time. And it's a good question. And I think it really speaks to the difference between what you can put in a book and what you can do when you spend time counseling patients. And, what you put in a book, you're not getting feedback. There's not that back and forth. You don't get to say, well, of all these things, what would you want the most of, and work with patients to come up with something they can stick with. You can't do that in a book, but you can do that when you meet with people. And so the book is kind of written in a very stepwise fashion, and that's how books work. But when you meet with somebody, then you can kind of take it to the next level. And I think that's what happens in our support groups.
Totally.
So, yeah, great question. And the answer is it depends, right? I mean, like everything we say, it depends. And that's where the nuance comes in. But I think the take-home point is you back off the Metabolic Reset Diet if you need to, with the thing that you're missing the most. And in the least intrusive, it doesn't mean like 2 Big Macs a week is like how you back off the Metabolic Reset Diet.
Maybe you put that little sprinkle of Parmesan cheese on your thing versus,
Right. Exactly. All right. Okay, let's move on to the next question.
Next question comes from Ellen by email. Will all sleeve patients need to be on GLP-1 medications at some point?
Okay, so this is a big question. And first of all, I don't think we really know the answer to this because these meds are new. We know sleeve patients have a higher rate of weight regain compared to pretty much any other surgery, save for maybe the lap band, which is really not done anymore. The best guess, if you look through the data, the best number that's out there is 30% of sleeve patients regain at least half of their lost weight. There are studies that show as high as 76% number. And the problem is each study kind of defines weight regain differently. And so my take is it's higher than 30%, but also I think it's lower than 76%. If I had to put a number out there, I'd say about 50%. That 50% of sleeve patients will really struggle with significant weight regain. I think there's another interesting study I found when I was kind of looking through and preparing for the podcast, which is they implemented behavioral therapy, and which basically means working with a dietitian for patients who are experiencing weight regain after a sleeve gastrectomy, and they found less than 1% total body weight loss.
Yikes!
From just working on nutrition to treat sleeve-related weight regain.
I mean, that just really emphasizes that obesity is a disease that needs to be combated at multiple angles.
Yeah. It just shows that this is physiologic weight gain. It's like weight gain from medications, right? It's like weight gain from diabetes. It's a metabolic disease. And so behavioral therapy doesn't work well. We don't tell people if you come in and your blood pressure is 180 over 90, they don't give you meditation exercises. They give you medication, not meditation. And so we have to look at obesity that same way. You're 10 pounds overweight, work with a dietitian. Love it.
Yeah.
You're 50 pounds overweight, it's meds and surgery that's going to get the job done reliably. And I think we've accepted that weight regain, that weight gain, that weight loss failure from whatever we're doing to try to lose weight is acceptable. And we've kind of just normalized that in our society. We don't have to do that anymore. We've got surgery, we've got meds, we have treatment where almost anybody can lose a substantial amount of weight if they want to. And I think we have to start normalizing that, hey, this is a metabolic disease. We have to do everything we possibly can. So getting back to the question, I think at least half the sleeve patients are going to need to be on GLP-1 medications for the long term in order to get durable weight loss. Mm-hmm. And, we can't just start looking at weight regain and blaming the victim here, right? We look, they didn't take it seriously. They
didn't try hard enough.
They ate through it. Mm-hmm. That's the statement I hear.
Stretched out their stomach.
And that's not what's happening. It's really just a hormonal failure. Where the initial weight loss effects driven by the sleeve, your body adapts and adjusts to those hormonal shifts and gets the set point goes back up. And so we need to treat that with medications, I think. And we've had great success in treating it. That's, to me, the exciting thing, is you don't need a revision surgery, because revisions after a sleeve, with the exception of revision to a bypass for reflux, but if we're talking SADI or duodenal switch, those are rough surgeries. I mean...
Well, and the amount of weight loss difference after the sleeve and then the bypass, it's generally not as much as we can get with the meds, right?
Probably not. Yeah, I would agree. I think you might lose more weight by using meds after weight regain from a sleeve than converting to a bypass. Yeah, I don't know that we've done that study. But I think you're probably right about that. Mm-hmm. Yeah. Mm-hmm. So anyway, I think that about half the patients at least are going to need GLP-1 meds. And I think it also depends on where you start, right? If you're, 5'6", 205 pounds, you might be in better shape and more able to not use GLP-1s than if your BMI is 55 and you're having a sleeve.
Right.
In that case, if I'm talking to a patient with a BMI of 55 and we're working toward a sleeve for whatever reason, I'm letting them know meds are part of the deal here. We have no expectation that a sleeve alone is going to solve your problem. Mm-hmm. And I think it's just important to go into the surgery with that understanding and expectation. There's nothing wrong with it. But if someone says to me, I don't ever want to take meds long term,
well, we're not doing the sleeve.
I wouldn't recommend a sleeve in that setting.
Yeah.
And I think that's really the take-home point. I think the second point is, if you've gained weight from the meds, if we gain weight after a sleeve, then the meds are really effective. Mm-hmm. And, we're treating patients from all over the country now with this and seeing fantastic results.
Right.
This last question is from Sharon on our YouTube Hair Loss Short. Is there anything I can do to minimize hair loss after surgery?
All right. So Zoe, what do you think patients can do to minimize hair loss after surgery?
Well, we want to think about the supplementation after surgery as supplementation as soon as you decide you want to get surgery.
Yeah.
I had this conversation with somebody today. Basically, when do I need to start meds? When you decide to get surgery, because then that gives us several months of taking your bariatric multivitamin to build up those reserves, build up some stores, specifically with iron, so that you can prevent the hair loss, because those first couple weeks, after surgery, you likely won't be able to take your vitamins, but we want to make sure that you, A, build up stores, B, don't go into surgery already deficient in anything, and then therefore more likely to lose your hair.
Yeah. Yeah, I think that's absolutely critical. And we've kind of changed that in our practice, getting patients on vitamins earlier and earlier in the process. And I think once you start moving down the path to surgery, that's the time to start taking bariatric vitamins. Vitamin stores, we can, it's not like carbohydrates or fats where we have like a couple days of stores and then you run into trouble. We have months and months of stores of certain vitamins. It's different, B12 is going to be different than thiamine, going to be different than iron. But yes, building up those stores is critical. I think the second thing that we're starting to do, and we also are starting patients on it sooner rather than later, again, months before surgery, is starting them on minoxidil, which is a blood pressure medicine. So not everybody's going to be a candidate for it, but minoxidil is generic. It's over the counter. It's cheap. We will sometimes add spironolactone and some other medications as well. And the combination of that, we think, can also reduce hair loss as well after surgery. So that's, I think, another piece that should be explored. And even the Rogaine roll-ons and the stuff you can get at the drugstore. I think, nobody wants to lose hair after the surgery.
Right.
And in the past, truthfully, I've kind of been like, well, it's going to grow back, but that doesn't help you for the year and a half that your hair is thinning. And truthfully, maybe it's that my hair's finally started to thin a little bit, and I've become sensitive to that. I'm not sure, but I think that we have to be as aggressive as we can. And these are some treatments that are inexpensive, well tolerated, and if they can reduce hair loss, we should go for it.
Yeah, absolutely.
All right, another great episode.
Yes, great questions. If you have any questions, feel free to put them over to us on social media or on our website.
Right.
Comment on the YouTube video. We want to hear your questions so we can answer them on the podcast.